The World Health Organization says it has confirmed 62 attacks on healthcare assets in Ukraine since the conflict began and through last Friday. The assets include hospitals and medical facilities, transport of medical supplies, warehouses, and healthcare workers. Meanwhile, international medical aid groups have come to the war-ravaged country to assist those fleeing for safety or those who are hurt from Russian attacks. Joining us now to give us a perspective of the healthcare system and medical aid on the ground in Ukraine is Doctor Anthony Fong, clinical lead and emergency physician at Canadian Medical Assistance Teams, or CMAT. He joins us from a medical checkpoint in Ukraine near the Polish border. Dr. Fong, welcome to Forum Daily.
Thank you very much, Nima. Glad to be with you.
Sir, tell us a little bit more about the work you're doing on the ground and what kind of challenges you and your team are facing amid this war.
So CMAT has been providing mostly primary care, and that means mostly what you would imagine a family doctor would do, and providing a lot of urgent care, and kind of what you would want to see, what you would normally see in a walk-in clinic. We've been seeing lots of people with chronic disease like hypertension, diabetes, high blood pressure, lots of cough and cold, headaches, and anxiety.
All right, doctor. Well, what is the current state of these medical checkpoints? Do you have enough supplies to assist all of those who are coming through?
Currently, we're doing really well with supplies. We've been lucky enough to have very generous donations of medications and medical equipment, and we've been able to put them to good use. And when we run out of something, we've been able to very effectively source out replacement equipment. What we do always highly value and can always need more of is, during these disaster deployments, I think we always highly value people who understand the culture and speak the local language. And in this case, we're working with in Poland with Polish-speaking peoples, as well as in Ukraine with Ukrainian-speaking peoples.
All right, doctor. Well, we mentioned there have been over 60 attacks on healthcare assets in Ukraine. So what is the current state of Ukraine's overall healthcare system?
Well, Nima, I can't comment directly as to Ukraine's healthcare system, as we don't work within it. But what I can say is that out east, where there is active conflict and violence and shelling, there are definite needs for medical supplies. And close to the Polish-Ukrainian border, there are few resources from the Ukrainian side in order to staff those regions. So that's where CMAT comes in, and other NGOs that are assisting in providing care to refugees who show up to the border after sometimes traveling for hundreds or even 1,000 kilometers, and are hungry and have medical conditions that need treatment.
So how are you and your team handling this stressful situation right now?
I think ours is a very diverse team consisting of nurses, doctors. We have 2 emergency physicians, other than me, another emergency physician on the team. We have 2 pediatric ER nurses. We have other nurses on the team as well, nurse practitioner, as well as a team psychologist. So we have a very diverse team that's capable of providing the full scope of emergency medical services in this challenging place, quite independently. And also we came with our own equipment, so that helps a lot. As for dealing with the stress, so Nima, the air alarms do go on every night here. So certainly safety is always on our mind. However, we do have very firm, robust safety contingency plans. Our team has been able to secure insurance for ourselves as well across the border. And really along the border, we are just meters away from the Polish border. So we've actually felt very secure here.
All right, doctor, it sounds like you've got a very brave and a very passionate team, sir. So just a quick 30 seconds left here, but how can our Canadian viewers help you and your team's efforts?
Sure, that's a great question. I think one of the things on the top of my team's mind, we had a discussion actually earlier as to this, is just to be careful about information that you see on social media, and if you decide to share something, be very careful that it's correct information, comes from a reputable source, and be careful not to spread misinformation, as well as if you decide to donate to various charities or organizations. I highly recommend just checking out as to how they're spending those funds and making sure that they're doing good work and putting it to good use.
All right, Dr. Fong, thank you again for your time today.